Hello, and welcome to the 10th episode of the Ask a Counselor series. I'm Christine McMinn,
I'm Missy Petty.
And I'm Kelly Navarre.
and today's topic is all about counseling. So we decided to take our 10th episode and just share a little bit more with you guys about what to expect with counseling. As we were kind of preparing for today, we realized, as usual, there were so many different directions that we could take this conversation in. So we've put together a frequently asked question sheet that will be linked to this video if you're interested for learning just a little bit more about what is counseling, and just a couple kind of specific nuances to counseling at Living Well. But for today's purposes, we're really going to talk about kind of how do you know if counseling might be right for you. And so we came up with a couple of things that, if any of these are true for you, then counseling might be right for you. So I think, Kelly, you were going to get us started with the first one.
Yeah. So many times people will come in because they feel like they may be censoring themselves with their loved ones for what they're talking about with their friends and family. We know this to be true for patients, caregivers, and the bereaved. We often hear fears of being a burden on somebody by talking about things too much. From the caregiver side, not wanting to put their feelings in addition to what the patient is feeling. So not holding back talking about their emotional response. So that's a space that counseling, we're really pointed and we're talking about those things. I think another thing that fits into this piece is that when cancer is in a family, that's where the discussion tends to go around. And so sometimes people will come in and they'll really talk about wanting to have other conversations with friends and family, not just cancer specific. So they have that space to come in to talk with it about us because that's what we're here for. And that provides a little bit more room in your other life on the outside of counseling to have those different types of conversations with friends and family that are not necessarily cancer related.
Another thing I tell people is if you feel like you don't recognize yourself, now might be a good time for counseling. And I mean that both ways. For a lot of patients in particular, they don't recognize themselves physically due to changes because of their treatment, whether that's surgery or chemo or radiation, their struggle with self-esteem or body image, or you just don't recognize yourself emotionally, whether that's feeling down more often than you're used to, feeling a heightened sense of worry, noticing a change in how you're interacting with relationships, or getting that feedback that you seem different or you seem not like yourself. All of that is kind of to be expected when you or a loved one are going through a cancer experience or when you're grieving. But counseling is a great place to take that, to get kind of reacquainted with yourself and to make sense of that.
So another thing that, if you're experiencing this, it may be that counseling might be helpful is just if you're kind of struggling with all of the changes that can come into the picture with a diagnosis. And again, that's whether you're the individual with a diagnosis, you have a loved one with a diagnosis, or if you've lost someone from a diagnosis, that there's just a plethora of changes that are introduced into your world in all facets, all areas of your life. And it's a lot to be adjusting to. The news of a diagnosis in and of itself just typically kind of shatters people's worlds and makes everything look unrecognizable, physically, emotionally, all those things that we're talking about here. And so counseling really is a space to just kind of sit with a lot of those things. Usually when we're talking with other people, well-intentioned, but a lot of times people will try to come up with solutions or fixes to things. And sometimes there just isn't a solution or a fix. And we just need to kind of sit with what's going on and validate it and just hold some space for it. And so counseling is a great space to do just that.
Yeah. And if you're thinking, oh, maybe counseling does sound like a good fit for me right now, you may also be wondering, what does it look like once I get there? So there for us right now is over the phone or virtual using video, though we hope to be back in the office. But usually the first meeting or two is a lot of background and a lot of getting to know you. So the question I always ask clients, in addition to some standard background questions, is, what do I need to know about you? Or what do you feel like you need to share with me in order for me to be best positioned to support you and also to best understand how you look at the world?
And then from there, we go into really setting up the goals and how counseling is going to be structured. Sometimes it looks as if people really have some structured goals that they're wanting to process through and get through. And sometimes it more or less just looks more like a processing type goals.
Then the other thing is just kind of frequency, how often to expect to come in. And really that's kind of up to you. Once you've established those goals, like Kelly was talking about, one of the things that I sometimes talk about with people, it sounds kind of strange at the beginning, but how would we know that we wouldn't maybe need to work together anymore? We wouldn't need to work together as often. And so it's really, kind of the counselor's job to check in with you on progress, how you're feeling that the counseling process is going, if you feel like you're accomplishing those goals. And then from there, as people feel like, yeah, I do see some progress there, we typically space appointments out and push them out to be kind of more maintenance based before kind of officially hitting the pause button on services.
So if this has kind of spurred you on to set up a counseling appointment, it's actually very easy. You can email us at the counselor, email at counseling@livingwellcrc.org, or call our main line and one of us will get back to you. And literally, we just look at the schedule, talk with you a little bit about what's bringing you in, and set you up. It's a very easy process. And with it being virtually, we can email you the paperwork and you can do it all online. So it's very quick and easy. Oftentimes we'll get people set up, very fast, and they'll see a counselor within a week or two. So that is it for us. Again, if you have any questions, please feel free to reach out to us at our email. Thanks.